disease was once considered a problem of old age. But today, we are seeing heart attacks in people in their 20s, 30s, and 40s. Why is this happening? Why are young, active-looking individuals suddenly collapsing from heart problems? In this video, I will explain the real reasons behind the rise of heart disease in young people, and most importantly, what you can do to prevent it. When we talk about heart disease in young adults, we usually mean blockage in heart arteries, coronary artery disease, heart attack, heart rhythm problems, and sudden cardiac arrest. The most common cause is blockage in the coronary arteries that supply blood to the heart muscle. Years ago, this mostly affected people over 55. Now, we are seeing it much earlier. Let's break down the main causes, why young people are affected. Today's generation sits for long hours, does desk jobs, has a high screen time, and has minimal physical activity. Lack of movement slows metabolism, increases fat accumulation, and raises blood pressure. Your heart is a muscle. If you don't use it properly, it weakens. Fast food, processed food, sugary drinks, and high salt intake are major contributors. Excess of trans fats, refined carbohydrates, sugary beverages, increase cholesterol, obesity, and diabetes, all of which damage heart arteries over time. Chronic stress is one of the biggest silent killers. Work pressure, financial burden, academic stress, social media comparison, stress increases blood pressure, heart rate, and stress hormones like cortisol. Over time, this damages blood vessels and accelerates artery blockage. Many young people think vaping is safe. It is not harmless. Nicotine constricts blood vessels, increases blood pressure, and damages artery lining. Even occasional smoking increases the risk of heart attack significantly. We are seeing type 2 diabetes in teenagers and young adults. Excess body weight causes insulin resistance, high blood sugar, and high cholesterol. These directly damage coronary arteries. High caffeine energy drinks are increasingly popular. These can increase heart rate, raise blood pressure, and trigger arrhythmias. In some cases, they can precipitate sudden cardiac events. Sleeping less than 6 hours regularly increases blood pressure, inflammation, and risk of heart disease. The heart needs proper recovery time. Some young people have a family history of early heart attacks, high cholesterol, or sudden cardiac death. If your father or brother had heart disease before 55, your risk is higher. That means prevention must start early. Many young patients ignore symptoms because they think, I'm too young for heart disease. Warning signs include chest discomfort, breathlessness, unusual fatigue, palpitations, or pain in arm or jaw. Never ignore these symptoms. Here are simple but powerful steps. Exercise at least 30 minutes daily. Maintain healthy body weight. Stop smoking completely. Reduce junk and processed food. Manage stress, meditation, prayer, walking, sleep 7 to 8 hours. And check blood pressure, cholesterol, and sugar regularly. Prevention is always easier than treatment. Heart disease is no longer an old person's disease. It is becoming a lifestyle disease. The good news, most of the causes are preventable. Your daily habits determine your heart's future. Start protecting your heart today, not after a heart attack. If you found this video helpful, share it with someone young who needs to hear this message.